Now, one of the plans that we've talked about is a public option, and part of the reason we want to have a public option is just to help keep the insurance companies honest. If the insurance companies are providing good care, and as it is, they're going to be more regulated so that they can't deny you care because of a pre-existing condition, or because you changed jobs, or because they've decided you're too sick and not a good risk. If with regulation, there's already going to be some improvement in the insurance industry. But having a public plan out there that also shows that maybe if you take some of the profit motive out, maybe if you are reducing some of the administrative costs, that you can get an even better deal, that's going to incentivize the private sector to do even better. And that's a good thing. That's a good thing. Now, there have been reports just over the last couple of days of insurance companies making record profits. Right now, at a time when everybody's getting hammered, they're making record profits and premiums are going up. What's the constraint on that? How can you ensure that those costs aren't being passed on to employers or passed on to employees, the American people, ordinary middle-class families, in a way that over time is going to make them broke? Well, part of the way is to make sure that there's some competition out there. So that's the idea. Now, to get to your original question, can I guarantee that there are going to be no changes in the healthcare delivery system? No. The whole point of this is to try to encourage changes that work for the American people and make them healthier. Now, the government already is making some of these decisions. More importantly, insurance companies right now are making those decisions. And part of what we want to do is to make sure that those decisions are being made by doctors and medical experts based on evidence, based on what works. Because that's not how it's working right now. That's not how it's working right now. Right now, doctors a lot of times are forced to make decisions based on the fee payment schedule that's out there. So if they're looking and you come in and you've got a bad sore throat, or your child has a bad sore throat, or has repeated sore throats, the doctor may look at the reimbursement system and say to himself, you know what, I make a lot more money if I take this kid's tonsils out. Now, that may be the right thing to do, but I'd rather have that doctor making those decisions just based on whether you really need your kid's tonsils out, or whether it might make more sense just to change. Maybe they have allergies. Maybe they have something else that would make a difference. So part of what we want to do is to free doctors, patients, hospitals to make decisions based on what's best for patient care. And that's the whole idea behind Mayo. That's the whole idea behind the Cleveland Clinic.